Hello everyone, welcome back to my channel. Today I am going to talk about diuretics. Let's see what are diuretics. Diuretics are agents that stimulate the kidneys to produce more urine by flushing excess fluid and minerals from the body. Diuretics are used for many indications. Let's see what are the main indications that use diuretics. It's vastly used for hypertension. In order to reduce hypertension, diuretics are used. Secondly, it's used for heart failure. Then for edema, as well as it's used for liver cirrhosis as well. First of all, a diuretic reduces reabsorption of sodium by neprone. Because of this, natriuresis may occur. That means high level of sodium in the kidney. Because of this, water retention of kidney occur. And the urine concentration may lower by increasing the water concentration. That makes kidney to produce more urine. Let's see what is the normal function of a kidney and a nephron. So you all know it consists of glomerulus, proximal convoluted tubule, loop of Henle, distal convoluted tubule and collecting ducts. Inside a kidney, nephrons are all over the kidney, where the loop of Henle is inside the medulla of the kidney, where the cortex have the glomerulus, other proximal and distal convoluted tubules. Let's move on to the nephrons activity. Here in the glomerulus, there is a certain kind of a pressure that creates by the capillaries, where the afferent arteriole comes by the plasmas and efferent arterioles goes away from the glomerulus. Because of these capillaries, there is a huge hydrostatic pressure inside the glomerulus, where the 20% of the plasma may filtrate into the brown capsule by these pores and by using the hydrostatic pressure inside the glomerulus. Because of the high permeability of these capillaries of water and other electrolytes, those will filtrate through the pores into the brown capsule, around 20% of this plasma. Then it will go to the proximal convoluted tubule. Here I should have mentioned you all the proximal convoluted tubule, distal convoluted tubule and glomerulus is in the cortex of kidney, where the loop of Henle and the collecting ducts are in the medulla of kidney. It's 20% of plasma, around 65 to 70% of sodium may reabsorb into the bloodstream. The isometric mechanism will help to this reabsorption. Here also the water and bicarbonate may reabsorb. Then as the tubules dive into the medulla or middle zone of the kidney, the tubules become narrower and form a loop, where we call it loop of Henle. This one is a descending loop of Henle, where the loop of Henle makes a thick ascending loop of Henle towards to the distal convoluted tube. This thick ascending loop of Henle is impermeable to water, and it reabsorbs potassium, sodium and chlorine to the 1, 1 and 2 ratio. The interstium of the medulla, which means as I mentioned here the capillaries are going through this loop of Henle also. And the medulla tissues, we call it interstium, is somewhere between the here. Those are medulla interstium, especially it's really hypertrophic. Medulla interstium is very hypersomatic, and the loop of Henle is very permeable to the water, where it's reabsorbed water a lot. But the thick ascending loop of Henle is not permeable to water. Here it makes more urine concentrated due to this hyperosmoticity of the medulla interstium, as well as the high permeability of water of the loop of Henle. Then this urine goes towards the distal convoluted tube. Here there is a mechanism that reabsorbs sodium by exchange of potassium and hydrogen. This activity of the distal convoluted tube depends on the sodium concentration of the urine. If the sodium concentration is high, reabsorption will be high, where the potassium and hydrogen level of the distal convoluted tubule will be high. This mechanism is regulated by aldosterone that's secreted by the adrenal cortex. In the end, urine will pass to the collecting tubules, where the water reabsorption will occur again. The ADH hormone is the hormone that facilitates this reabsorption of water in the collecting duct. Let's move on to the classification of diuretics. We can classify diuretics according to their site of actions as well as according to their potency. We can classify diuretics by according to the site that it acts on the neprone, as thick ascending loop of Henle, early distal tube, or the collecting tubules and ducts. But most popular classification of diuretic is according to their potency. As I mentioned here, very potent diuretic, moderate potent diuretics and weak diuretics. Very potent diuretics are we call loop diuretics, where it acts on the loop of Henle. As an example, furosemide. Moderately potent diuretics are thiazide derivatives. As an example, I have mentioned here hydrochlorothiazide. There are few weak diuretics as potassium sparing, osmotic diuretics, and carbonic anhydrate inhibitors. I'm here going to talk briefly about all those diuretics. I'm going to talk about the drug class and what are the drugs in that class, indications, adverse effect, contraindications, and drug interactions. Let's see what are the loop diuretics. Most famous loop diuretic is furosemide. Where around 40 milligram is the usual strength of the drug. And secondly, furosemide. Thirdly, ethylenic acid. Indications of loop diuretics. First and most important is edema. Then it also used for hyponatremia, where the sodium level of plasma is calcium. There is an adverse effect. This can cause hypocalcemia. Also cause ototoxicity. And finally, due to urinary retention, patient with enlarged prostate. Contraindications to use loop diuretics are severe sodium and volume depletion, patient with severe sodium and volume depletion in their plasma should not use furosemide because furosemide reduce the reabsorption of sodium and H2O from the neprone to the plasma. If the patient is having a severe sodium and volume depletion, furosemide may worsen this situation. And it should not also use patient with anuria. Anuria means the lack of urine. Furosemide interact with digoxin. Furosemide interact with digoxin where the arrhythmias may occur. It also interact with thiazide in good way, where the thiazides and loop diuretics are used as a combination for these indications, where the effect of the loop diuretics is become high. It also interacts with heparin, where the anticoagulant activity will increase. On the thiazides. Drugs. Let's move to thiazides. Drugs of this category is most popular one is HCT, hydrochlorothiazide, and the metal salt. It's obviously used for hypertension. It's good for hypertension rather than the loop diuretics. And obviously it's used for edema and as well as chronic renal failure. Chronic renal failure. Thiazide diuretics can cause. These thiazide diuretics can cause and electrolyte abnormalities in patients. And it also causes hyponatremia in plasma. As a drug interaction, thiazide reduces the effect of insulin, where the increased effects of anesthetics and digoxin, where it can cause digoxin toxicity also. Let's move on to the potassium sparing diuretics. The most famous drug is spironolactone, where it comes as 25 mg dose usually, and neprone. Potassium sparing diuretics are used as modest diuretics, and also for the treatment-resistant hypertension, where the thiazide doesn't work. Carbonic anhydrate inhibitor is acetozolamide. As we all know, acetozolamide is popular for the treatment of glaucoma. It can cause adverse effects as metabolic acidosis, and the hyperkalemia. Its contraindication with patient with hepatic cirrhosis and COPD, chronic obstructive pulmonary diseases. Osmotic diuretic is IV mannitol. IV mannitol is the main osmotic diuretic that used to reduce intraocular pressure. It can cause hypersensitivity as well as headache. It should not be used with patients with anuria, as I mentioned earlier. That's it for my diuretic video, guys. Thank you.